Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Breast Lumps Biopsy. Introduction. Breast lumps are a common condition that affects millions of women every year. Men can also be affected by breast lumps. Breast lumps may be cancerous. Breast cancer occurs in approximately 1 in every 8 to 9 women. Your doctor may have recommended a biopsy to determine if your lump is cancerous or not. The decision whether or not to have a breast biopsy is also yours. This patient education module will help you understand better the benefits and risks of a breast biopsy. Anatomy. The breast contains glands responsible for making, storing, and delivering milk. Milk is usually produced in women's breasts after the delivery of a baby. The milk is made and stored in the glands inside the breast tissue. From the glands, milk flows through special ducts to the outside, passing through the nipple area. Symptoms and their causes. Many lumps are discovered by patients themselves during a breast self-exam. Routine mammograms can also detect lesions too small to be felt by hand. Most lumps found in the breast are not cancerous. However, all lumps should be examined by your doctor to make sure they are not cancerous. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Medical examination. Your doctor will review your medical history and examine your breasts to determine if your breasts are healthy. Your doctor may also recommend other tests such as ultrasound and mammography to diagnose breast lumps. Your doctor may also request a breast biopsy to determine if a lump is cancerous. A biopsy means that either a small part of a lump or the whole lump is taken out for a pathologist to look at and decide if it is cancerous. Surgical procedure. Breast biopsies are done under either local or general anesthesia. The following describes many ways to do biopsies. In a needle biopsy, a needle may be inserted in the lump, and fluid and tissue samples taken for pathological studies. If the lump is filled with fluid, your doctor can remove all the fluid during a needle biopsy, and no further surgery may be needed. In an incisional biopsy, a small part of the lump is taken out through an incision. In an excisional biopsy, the entire lump and some surrounding tissue is removed through an incision. This is known as lumpectomy. During a biopsy, if the lump is small or deep and cannot be located easily, a flexible wire may be placed in it under X-ray guidance by a radiologist. The surgeon then follows the wire to the lesion. This is known as wire localization. Your doctor will help you decide which type of breast biopsy is most suited for you. The pathologist will examine the sample of tissue taken from your breast during biopsy and determine if it is cancerous, malignant, or not cancerous, benign. If the lump is benign, not cancerous, no further surgery may be needed. If, on the other hand, the lump is cancerous, more extensive surgery may be needed. For open biopsies, an incision is made and taken down to the lump. After the operation is completed, the skin is closed. Needle biopsies are done through a needle puncture. In these cases, an incision may not be made. At times, the radiologist or surgeon can do the biopsy using radiological guidance. This is known as stereotactic breast biopsy. The potentially abnormal area is located using a special mammography machine. While the breast is still in the machine, the doctor inserts a needle in the abnormal area and takes a piece of it. Because the patient does not move in the machine, the doctor can be certain that the biopsy was taken from the abnormal area. Risks and complications. Breast biopsy is very safe. There are, however, several possible risks and complications. These are unlikely but possible. You need to know about them just in case they happen. By being informed, you may be able to help your doctor detect complications early. The risks and complications include those related to anesthesia and those related to any type of surgery. Risks related to anesthesia include, but are not limited to, strokes, kidney failure, pneumonia, and blood clots in the legs. These risks will be discussed with you in greater detail by your anesthesiologist or nurse anesthetist. Some of the risks are seen in any type of surgery. These include 1. Infection, deep or at the skin level. Treating deep infections may require long-term antibiotics and possibly surgery. 2. Bleeding, either during or after the operation. This may necessitate a blood transfusion or another operation. Fluid may collect under the skin, which is known as seroma. This may need to be taken out with a needle. A seroma could cause the incision to open up. 3. Skin scars that may be painful or ugly. After the biopsy. Breast biopsies are outpatient procedures. It is a same-day surgery where the patient goes home after the surgery. After surgery, you will be taken to the recovery area where you will be monitored by a nurse. When you wake up, the nurse will ask you to drink and sit up. An adult should drive you home because you may feel temporarily drowsy, particularly if the biopsy was done under general anesthesia. Your healthcare provider will give you instructions before you go home. These may include 1. Not showering for a day or two. 2. Applying an ice bag to the incision to reduce the swelling and to ease pain. Make sure to contact your doctor in case of any new symptoms, such as fever, bleeding, severe pain, weakness, swelling, or infection. If you like this video, please like and share. For similar videos, subscribe to our channel. Summary. Breast lumps are a common condition that affects millions of women every year. Men can also be affected by breast lumps. These lumps should be thoroughly examined to determine if they are cancerous. Most lumps found in the breast are not cancerous. A breast biopsy helps determine if a breast lump is cancerous. A biopsy means that either a small part of a lump or the whole lump is taken out for a pathologist to look at. If the lump is benign, not cancerous, no further surgery may be needed. If, on the other hand, the lump is cancerous, more extensive surgery may be needed. Breast biopsy is a very safe procedure. Risks and complications are very rare. Knowing about them will help you detect and treat them early. Thank you for using Explain.